We have a few items today proposed for vote only. Generally, we'll have an update from the OIG on their most recent semi-annual report, but the subject of this hearing is prison health care, an ongoing concern that does not appear to be materially improving. We really are going to want to look in depth at what has happened and what needs to get better. So the first we'll simply deal with the two vote-only items that are before us. Is there any public comment on the spring finance letter of the parole revocation and compliance workload, or the request of the Attorney General litigation services and the governor for 5 additional full-time deputy attorneys? Okay, seeing and hearing none. Is there a motion on the spring finance letter to approve?
So moved.
Thank you. Please read the roll.
Madam Chair.
Aye.
Senator Anderson. Senator Mitchell.
Aye.
Okay, we'll hold the roll open for Senator Anderson, but that will pass. Now, the recommendation is that we reject the Office of Attorney General Litigation Services proposal because our legal problems seem to be diminishing. Our court cases should be less. There are 150 attorneys and a paralegal staff on board with the Attorney General's office for these cases now. This should be going down, we think, not up. And CDCR also has 112 in-house attorneys and about $69 million. It seems that this should be adequate for where we are now.
So, Madam Chair, I move to reject the proposal.
Okay. Please read the roll.
Madam Chair.
Aye.
Senator Anderson. Senator Mitchell.
Aye.
Okay. We will move on to our report from the Inspector General. Welcome to the committee, Inspector General Barton.
Good morning.
And we're hoping that you'll begin by presenting an overview of your recent report.
And that I would be pleased to do. As the committee knows, we monitor a number of programs within CDCR. Our semi-annual reports are by statute published every 6 months. They cover our discipline monitoring, our critical incident, which includes use of force, and our contraband watch monitoring, all programs within the department that have the potential for liability to the state and the taxpayers. And so we have it distributed in Volume 1 and Volume 2. We go through cases that we have closed because they are at that point available to be reported. And then we talk about specific recommendations and trends that that we've made to the department, their response to those recommendations, et cetera. In the discipline arena this last 6 months, there were a few things that we saw that were of concern. One specifically is the State Personnel Board process, whereby outside entities can bring cases to the State Personnel Board without going through the department. And most of the time, those cases are being brought against CDCR employees. In one of those cases, it was against investigators who had investigated a case that our office felt should be investigated. And we just commented that that process should be looked at. We don't have jurisdiction over the State Personnel Board, but it's a concern that investigators who are doing a good faith investigation should not be subject to charges simply because an administrative law judge feels that the case wasn't proved. And so that was a concern that we addressed. But along the way, in looking at that particular case, we also came across other cases where the department's attorneys were representing their employees, and yet they were going to be the hiring authority that would have had to been imposing discipline if the State Personnel Board had rules against those very employees, which we saw as a conflict. We had dialogue with the department over that issue, back and forth between our office and their office, and ultimately they've changed their policies and procedures to use the Attorney General's office, to use other attorneys for that purpose. Probably one of the most glaring examples was where this outside process was used to make an allegation against a parole administrator who then was advised by department counsel and acted as both the subject of the investigation and the person who settled the case, which we found to be inappropriate. So, but again, the department was responsive to our issues, and I'm not speaking to the underlying merits of that case against the administrator, but rather the process they went through. So I think it's important that we continue to point out these areas of concern for the process. The other thing is, within our reporting in the last several reports on the discipline side, again, we've seen a decrease in sufficiency of the investigations, both in process and outcome. And what I mean by that is there are many rules based upon timing that the department has put in place to make sure that investigations are submitted timely and completed timely and decided upon. And we've seen that those timelines have not been met or have been met less often in the last several reports. We've pointed this out to the department. Again, some of the issues have to do with staffing and budgets and things like that, and so we're hopeful that as that situation changes, they'll be able to improve in those areas. We're also trying to make the process, the reporting, more specific for them, because they've asked if we have problems with individuals, whether it be a warden or whether it be an attorney or whether it be a particular office, they would like to address that more specifically. So we're working on doing that as well. When you talk about our Volume 2 and the critical incidents, primarily we're talking about use of force. I know one of the questions was, do we have particular prisons that are worse than others? We do, but they tend to follow what one would expect. In other words, the high security prisons and prisons with reception centers where you have people that are not classified yet and maybe mixing with people that they're going to have conflict with, those tend to be where we have more of those use of force incidents. The opposite, where we have low-level inmates, female inmates, we tend to have less use of force incidents. I think that the critical question is not necessarily even which prisons have the most cases, because I can tell you that for the first 2 or 3 years on this job, we were troubled by those prisons that wouldn't refer cases. So in other words, we tried to push transparency, and so the fact that a prison is sending up cases to be investigated, A, doesn't mean that they have more problems, and B, doesn't mean all those cases are going to be sustained. It's also to us, we tend to get a little worried when prisons aren't sending a lot of cases, because then we want to go in and see, okay, are there cases that aren't getting through the appeal process, for example, or cases that aren't seeing the light of day. So simply going by, I think it would be a false context to say that because certain prisons refer more cases, they're the more problematic ones. They may be the more transparent ones. And so we're constantly working with the department and the administration when we believe that there are institutions where there's a problem in that area. And we have over the last 2 reports. Another question I was asked about was the responsiveness of the department. And again, we try to be value added. It's not just every 6 months that we talk to the department. We're talking to them on an ongoing basis. So when we identify systemic issues or, for example, it may be at one institution, it may be in one unit. We try to address those at that level, and whenever that fails, we take that up the chain of command all the way, if necessary, to the secretary level. So one of the problems that we're continuing to have, and you'll see in the reports, on our critical incidents is late notifications. One of the benefits, I believe, of a transparent outside agency, or the transparency we can bring, is that we can be on scene. We have people that respond to the prisons 24/7. If there is, a death in custody, a shooting, any critical incident that's going to subject the state, the taxpayers, to liability and risk, as well as the department and employees and inmates, we want to be there as quickly afterwards to see what's going on. And so in order to do that, we have to be notified. And it is a recurring issue that we've seen many cases where, if you get the call 8 hours later, by the time you get there, everything's done and gone. So that continues to be an issue we continue to try to address. The department is aware of the issue. They've asked us for reports on, which prisons, so they can drill down with the wardens and see what the issues are. I believe some of the responses that we've gotten are valid, in that you have such a high turnover in those ranks that watch commanders come and go at the prisons because it's at the lieutenant captain level above. And I think, as we all know, one of the challenges facing the department right now is the huge number of people that are hitting that 50-year retirement mark that we hired in the 80s. And so you have a lot of turnover in that ranks, and it's almost a retraining constantly. But our point is to the wardens, and certainly my point when I talk to wardens, is that they need to let their administrators know that, calling the IG, we're not coming out necessarily because, we're trying to find a critical incident. By definition is not misconduct. It's just a critical incident. Now, there may be misconduct, and if there is, we're certainly going to point that out. But having us there is a benefit to them, in my opinion, and I think in the opinion of most people. So I'm told that it's not because there's any sinister resistance to us being there, but the net effect at the end of the day is the same if we don't get called on time. So that's one of the issues that we're currently working with the department, and again, at the administrative level, they are responsive to that. I know that within our individual cases and regions, the individual managers are encouraged to take our report and actually use it as a management tool. So they'll go out and say, okay, in our region we had this many insufficient cases, let's look at why. We missed this deadline, we missed that deadline, we didn't do this type of interview, etc. And they actually try to use our reports in that manner. And so we're hopeful that that will continue.
Thank you. If I could just ask
Sure.
about that. So critical incidents are things like riots, homicides, escapes, use of deadly force, and unexpected inmate deaths.
Correct.
Did your office look into the pepper spray incident in Corcoran and the tracheotomy pepper spray death at Mule Creek?
Yes.
And did you have specific recommendations coming out of that?
Yes. So the Corcoran incident, which was some time ago,
Actually last September.
Right, but the other case, the Duran case, was the more recent one with the tracheotomy at Mule Creek. So in both cases, we were notified. We were on scene after we were notified of the inmates' deaths, and so we had somebody on the ground. So, for example, in the second case, we actually recommended an investigation immediately, and that was started. Obviously, it was made public at some later point, and when we roll out to an institution, as you can well understand, and an investigation started, we don't publicize it at that point. But we were there, and we did recommend in both those cases investigations. And in the first case, we recommended the department review their pepper spray policy, certainly in certain locations, in terms of the amount, in terms of waiting times, in terms of assessment. And that was actually a recommendation that we had made a couple years prior when we had another incident of an inmate ultimately dying after controlled use of force involving pepper sprays. So it wasn't the first time that we had made that recommendation. And I have seen the memo since then where they are now adjusting their policies along those lines. Is it still totally what we recommended? No. I can tell you that. I think that there's still a lack of clarity in terms of how much time should be someone should wait. So for example, many of you have seen the videos now. I've seen those use of forces take place in person. And it strikes me that, once you spray a certain amount, you're really not getting much out of the next 2 cans of pepper spray. So, we've made that point. And so some of that is a training issue, some of that is a policy issue. Basically, up until just recently, it was you use as much as you need. Well, that's a subjective decision, for an officer who may not, or a sergeant or whoever's on scene. So, and again, when we are present, we don't inject ourselves into what's going on. We're there as a monitor. So all of that to say that I believe we've looked at other states. I know that our initial recommendation a few years ago was based on what we saw in Florida. We've talked about that with the administration, and now we're starting to see some movement in their direction. I know that some of the federal lawsuits have dealt with that, certainly the Coleman lawsuit when we're dealing with mental health inmates, and there's concerns by both experts for the department and for the plaintiffs in that case. So all of that are issues that we've seen and made recommendations on.
Thank you. When you have something, you have a prison like Corcoran. So it had the pepper spray incident in September. It also came up on the court medical inspections that recently took place as being very deficient in medical care. Is that a sign of a troubled institution, and how does that get flagged? That's what I meant when we asked the question about, are there certain institutions that seem to have systemic problems?
So my answer again would be yes. It does get flagged, but it's in different contexts. So when we do medical inspections, for example, or when we review the court experts' reports on those institutions, we certainly look at that aspect of how the prison is being run. But as you know, different entities run different parts of the prison. So medical may not be under the purview of the warden at all. In fact, it's not. And so when we look at that versus, say, use of force, which what we're talking about with the pepper spray incidents, those are two different internal supervisory responsibilities, if you will. And so I don't know that you can say, okay, you've got problems in these two areas, so that's a troubled prison. Now, I will say that when we have seen institutions where there's a lot of discipline for excessive force, so we're seeing a lot of cases like that, or integrity issues, and then we also see spikes in use of force or things that would be cross-indicative, if you will. We will certainly address those with both the institution and the administration. And so, that happened a couple years ago in some issues that we were having at High Desert. In fact, you may recall we did a special review as a result. So, we have issues at times that we see more than one problem at a prison, and depending on whether they're linked would depend on whether we take it further.
Okay. We find your reports extremely helpful. Sometimes they raise, additional questions, which is so that, in the future, it would be very helpful if we could see displayed kind of by prison. It's almost like in education now we have the individual, they call it a report card in education, that's up on the web, and you could see how a school is doing on many areas. It would be helpful, I think, if we could have something like that in your reports. And we understand, of course, if you're dealing with a level 4 or a level 1, you're going to have probably a different range of incidents. But so we can see and kind of identify areas that the legislature needs to look at from a policy and budget perspective.
And that would be easy enough to do, and I would be
Yeah.
happy to talk to your staff about how we would, formulate those appendixes. I mean, the information is there. Again, we were not wanting, again, to put things out of context and simply put a chart out there that lists things that maybe isn't contextual. But I think if we did it in a way where maybe we separated out those missions so it was clear that, okay, within all the reception centers, who's got the most incidents? Within all the high security. So there might be a way to do it that would be more informative.
Because I think for me, we'll have a conversation about that, because for me, I'm looking at kind of systemic trends.
Yes.
You know what I mean? And I think categorizing by type of facility is helpful. I don't know if I need to know individual.
Right.
But looking at systemic trends that we can be proactive in terms of attempting to provide resources or direction or support as the legislature is important.
And I would be happy to meet with either of your staff and look at that.
Maybe we can.
Okay.
We will definitely follow up on that. And just let me say, I actually think it would be helpful, though,
Okay.
to see if there are outlying institutions that appear to have more problems, because then
Because that could be a management issue.
is there an institution that is really doing it well?
Right, right.
And then.
Good point.
And then how do we do it? So we'll definitely follow up on that. In general, do you notice any trends
Yes.
in terms of critical incidents?
Again, what I can tell you is what the numbers basically show, and in deadly force and inmate death cases over our last 3 reports, they have increased, but not significantly. I mean, we're talking 29 to 28 to 31.
Yeah.
So not so significant that I would say it's of concern. What I will tell you, one of the trends, I guess, that I'm looking at is overall on our discipline cases. I've looked at our reports for the last 3 years, and it's nice to say that the discipline cases and the rate at which they're being sustained is not necessarily increasing, but I would have hoped we'd have more of a decrease overall. And I think a lot of that is something that I've talked to the secretary about, and I've talked to the administration about, and I've talked to individual wardens about, and that is they're very stressed for training hours. They have a certain amount of training for the officers, and then you've got overtime issues and everything else when you pull them out of their regular jobs. And yet, from my point of view, one of the most critical pieces of ongoing training that they don't have, that we do find in outside law enforcement agencies, certainly large ones, is what's called ongoing peer intervention training. So an officer gets ethics training in the academy, and then they show up and they may get something in their initial class, but then over time, having been myself in, brand new as a law enforcement, in a law enforcement agency as well as in the military, you get off the bus and the sergeant says, forget everything you learned, I'll tell you how we do that here. And, I have to suspect that happens. And so what's good about some of these, I know some of the troubled police forces like Chicago PD and New Orleans, and some of these have instituted is this peer intervention training, where basically I think a lot of our discipline issues in the prisons are bad judgment calls that if one officer would have simply headed the other person off could have been avoided instead of looking the other way. I will say the departments come around with our recommendations from early on, which is if an officer is supposed to be watching a unit and there's an allegation of misconduct against another officer, it used to be that all of a sudden the observing officer was doing something else and just wasn't looking when that incident occurred. However, the department has dealt with that by saying, well, okay, maybe you didn't fail to report it if you say you didn't see it, but then you neglected your duty because you weren't watching where you should have been. So you don't get to have, plausible deniability. You're either doing your job and watching where you should, or you saw it and you didn't report it. And so I will say that if you look at our categories, neglect of duty tends to still be one of our higher categories that we monitor, because if you think about it, on virtually any discipline case is going to involve neglect of duty, even a dishonesty case. Your duty is to tell the truth. So if you fail to do that, that's also neglect of duty. But I will say things like that, where we've worked by pointing out the issues, by making recommendations, the department has made those attempts to improve, but I would like to see something incorporated so that there's this ongoing training for officers as they go through their careers.
You're hitting on something that I think is extremely important. The training of our correctional staff, which is going to also go a long way to shaping a culture where you see or don't see what's going on. And I hope that we'll find a way to do that. I'm struck by your comments that, we're going to spend time one way or another, either investigating incidents or taking people and giving them training so hopefully the incidents don't occur. And I think this is something, that we need to flag. And, thank you for that. I have one other question. Well, actually, two. Have you found that CDCR, for whatever reason, is able to fix the problems that you identify in a reasonable period of time, or did the same problems arise over and over again?
So again, I would hesitate to generalize. There are problems that have come up on multiple occasions. So the pepper spray, for example, or the notice issues, for example. We recently had our last report before the one this year, so the last one of 2013, we brought up an issue on identifying dishonesty cases for investigation, and we even listed out examples, and I would say that I was less than pleased with the department's initial response, which, rather than looking at the merits of our recommendation, made a semantical distinction in how we phrased it. So this last report, we basically pointed that out, and the department at higher levels, I think, acknowledged that and said, you're right, we should be looking at not just the semantical distinctions, but the actual merits of the issues. And again, giving it context, they opened many dishonesty allegations. It's just, if you read our reports, you read the actual factual circumstances, I have yet to find anyone within or outside the system that looks at those and doesn't say, well, yeah, that's dishonest conduct. And I'm not saying it occurred, we're just trying to get the investigation started. So now, we do have a process. So after the second time we pointed out that it was still a problem and in fact had occurred, we now have a process where we can meet and discuss those cases at higher levels and come to some type of understanding on what investigation should be open. So I use that as just an anecdotal example of how sometimes the first time maybe we don't get across, but it looks like we are able to get across, and they have been responsive in other cases very quickly, and in some not so quickly. So it's hard for me to generalize and say across the board the department's not responsive. If I were to give you, a high, low to medium, or from the time I started until now, I would say that for the most part they are responsive.
Okay. Thank you, because I think one of the big questions before us today, and as we look at this budget and as we look at policy, is there the capacity to bring about the changes that are needed?
And I'm still hopeful. I mean, if we were at a point where I thought, okay, it's broken, investigators aren't doing their job at all, attorneys aren't doing their job at all, I certainly would talk about that in my reports. But because the department has responded, or if they were just saying, thanks for your recommendations, and ignore us, I mean, certainly we'd be in a different place.
Right. Well, thank you. I'm ready to move on to the medical inspections, BCP. I'm going to ask for public comment after we complete the OIG section. So there is, the governor has a proposal for $1.2 million general fund money to establish 4 permanent positions in the medical inspection unit of the OIG to evaluate the medical care provided to inmates. And the budget also proposes to reduce other positions by about $645,000, so the net cost would be about an increase of a little over $600,000. Please present the proposal.
Okay. So with the mandate that we have to monitor medical care within the prisons, I have always, from the time I became the Inspector General, felt that the model we were using, which was borrowing doctors from the receiver's office to do some of our evaluation, first of all, wasn't sustainable because when the receiver and Plata goes away, they won't be there anymore. Mm-hmm. And secondly, we were subject to criticism that somehow these doctors weren't in-house, they were part of the system they were monitoring. So in discussing that with the governor's office, we see in perpetuity as we go forward, even when Plata goes away, the fact that the inspections that we were conducting were policy adherence, making sure that people got to appointments on time, making sure they got their prescriptions on time, with the assumption being that if you're following good medical policy, good medical care follows. Well, that was pointed out by the court and their experts that that's a piece of the pie. The other piece is, okay, a doctor may be seeing you on time, but he may not be giving you good advice. Well, I don't have my own doctors to second guess that. So what we've done is we've supplemented our medical inspection program now to add a quality assessment, if you will, as opposed to simply the policy adherence. And in order to do that, we need medical staff. We looked at the model that we had and the number of prisons and the number of inspections that we're going to be trying to do and have made the proposal as a result. So what these doctors and nurses will be doing are what are called chart reviews, looking at cases within certain sample sizes at each prison to see what the level of care was. Now as a sort of side benefit, if you will, not at all the primary purpose for this, because I think we need this going forward, is the fact that the federal court has seen what we're doing and indicated that they have no interest in a duplication of efforts. And we've actually been consulting with the receiver's office and the department and the federal court on our program so that the court will actually use our reports then to make some determinations about medical care, both in policy adherence and quality, and not have to send out the whole separate team of experts to do those. So it may have some side benefit on the litigation side of it, but I want to be clear, I'm not a party to the litigation. We are going to do this independently, regardless of what happens in the litigation.
Okay, thank you for that, because the discrepancy between your evaluations and the Plata court experts that were sent out to do their own evaluation is striking, because your investigations seem to show 87% compliance, and then 6 out of the 10 institutions that were reviewed by the Plata experts were found inadequate.
And when you realize that they were looking at different things differently, it makes more sense. So, for example, we didn't look at the licensed facilities on the grounds because they were regulated by other agencies. The federal experts did. We didn't look at the care from that quality perspective. They did, because they were actual doctors. I mean, the experts, Well, and it's also more informed, because they have the expertise, and that's what I'm saying. An inspector can look through a chart and see what happened or what didn't happen and whether it was on time, but they're not a medical professional that can say that's what should have happened.
Right.
So yeah, there is some reason for that variance, and I think, as the receiver would tell you too, even within our reports, if you dug down deep enough, you'd see that while the general scores, as you indicated, would be going up, there were still certain areas that a medical staffer would be able to see, for example, that were below that 75% level. So part of it, as former educator, you understand, is how you report those statistics and those numbers and how informed the people are that are inputting that.
So your intention would be to basically duplicate with these 4 staff the kind of work that was done by the Plata medical experts evaluation.
Yeah, I don't know that it'll duplicate one for one, but we certainly are getting their input on what they did.
Yeah.
We're changing it slightly because obviously it's our program, and so as far as the standards, but like sample size and what we're looking at and those types of things, it'll be very similar, that second piece.
Okay. So this would take place in the next budget year?
Yes.
We have no indication that the receivership is going to resolve
Okay.
anytime soon. So are we being redundant?
Well,
That was the question I was
right.
going to have.
And no, it's not, because I know he's sitting behind me, but I am going to be monitoring the receiver in essence. So just as the federal experts were going out independent of the receiver and seeing how things were, I mean, that sort of is a reflection on how well the receiver is doing. So by us having these doctors, it'll be a similar thing. So it's not redundant because I'm not doing what the receiver does. I'm actually going to be able to monitor and report on how well the receivership has shaped the medical care or administrated it in such a way that they're achieving results.
Okay. Yeah, thank you. That will be very helpful as it informs the discussion that we're going to have. I wonder if there are comments from the public on any of the issues that have been raised by the OIG. Okay. Seeing and hearing none, thank you
Thank you.
very much. We're going to hold this item open.
That's fine. Thank you.
Anyway, yeah.